Hi, we are meeting Dr. Frizner. I have been trying to explore some of my local area because I've been a little bit too virtual lately. So in that exploration, I found a concierge medicine doctor. That makes you sound like a medicine man, Dr. Frizner.
Well, hello, it's nice to talk to you tonight.
Yes, yes.
Nice to be here. Thank you.
Good, good. We have some things in common in that people ask me, do I take insurance? And I cannot. I am a private pay. But you actually can work both systems. Can you tell us more about what a concierge medical doctor does?
Sure. So I'm a internal medicine trained physician, and I worked for 10 years in the hospital systems around Baltimore, and then another 10 years in nursing homes around Baltimore and DC area. I always enjoyed working in outpatient medicine, and I did work for about 3 or 4 years in a private practice, and always kind of loved the relationships that I built with patients. And so this past year, I decided to make a change again in my career and start a concierge practice. And what I really wanted to do was tell myself that I'm only going to see patients that I where I can spend at least an hour or so on, or 30 minutes to an hour. I'm not going to take insurance. It's only a self-pay program. And so my model and a lot of concierge medicine doctors models is you pay like $200 or a set fee a month. Mine is $200 a month. It varies here in Baltimore, but that's about average. And you can see the doctor. You can see me up to twice a month, and you can call me though whenever you want. If you have questions, if you or a loved one get admitted to the hospital and you're my patient, I'm happy to come visit you and sit in family meetings or just do a Zoom call or phone calls with the treating doctors at the hospital to help you and the family better understand what's going on. Because it can be very traumatic. There's a lot of information. There's tons of different doctors coming and going, and I can really help like organize the whole thing. I had one patient that really they just needed to know what unit, mom was on and how can I call them? How can they call the unit? And so
Right.
just by, a simple thing for us because I know how to navigate a hospital by
Yes.
getting them the phone number in the unit and ask for this nurse was just amazing, for them. So I really enjoy that. I want to be able to spend time with the patient, talk
Yes.
about all the problems, address all their concerns, and really take pride. What I take pride in is being able to really explain everything to the patient
Yes.
and explain their congestive heart failure and hypertension and stroke and diabetes, whatever. Turn all that into regular language so the
Right.
patient and their family can understand. And so they understand the medicines and why they're taking the medicines. So they don't, because it can be pretty daunting if you have just a couple chronic diseases like diabetes and high blood pressure, you're probably on maybe four medicines already.
Wow.
And so, or if you've had a history of a stroke or something else, you could be on 6, 7 medicines. So my goal is to really help the patient understand what the medicines are taking, so that way they don't go, oh, I don't know why I'm taking this, and then maybe they stop taking the medicine because they think it's not helping. So when the patient doesn't understand what they're doing, what they're taking, it can lead to non-compliance, which then can lead to worse outcomes. So just the idea of the concept of explaining everything to the patient and to
Mhm.
their families, I'm happy. I enjoy doing that. That's what I've been doing for 20 years of my life and career. And yeah, that's what's kind of what I feel like I really bring to the table. And then meeting people like you and helping with other kind of chronic diseases like dementia can also, obviously changes everybody's lives around them, especially the patient. And really, kind of learn from you and kind of get involved as a team, working in teams, but in the outpatient world is really.
Right. Right. We have so many of our caregivers, and this is years of experience, but we see that we don't get personalized care. Sometimes you don't even get an eye contact, which is really
Mhm.
frustrating. And then you've got the two part, right? In the dementia world, you've got the care partner that often isn't addressed. So you have a doc that'll either look at one or the other, and the
Yeah,
hand is always on the doorknob. You're like,
right,
get your hand off the doorknob. I have more to ask.
right,
Right?
right.
And then
Yeah.
they're rattling off these things, and yeah. So being prepared. I mean, we've had people that I coach them to take their questions and send them ahead to see if we can
Mhm.
get ahead of it. But this the concierge medicine thing really. I found it being very successful in St. Petersburg, where I was before the pandemic. Still work with a lot of people in that area. And there's a commitment level that's beyond, I think. When you look up the word concierge, it's this catch-all term, but it's about person-centered. It's like I'm here for you, and that's what we are all trying to do. We do it in support groups, we do it in Dr. Kate dementia coach training. Now I'm a PhD, so I always pale a little bit with the name of my company because it's not an MD. You guys have the big guns.
Yeah,
Mine's
but
psychological. I'm very much psychosocial, but I know that a care partner, caregiver's anxiety is definitely addressed much better with a doctor who is hearing them and who they're not afraid to reach out to, you know?
yeah, yeah. When you come to my practice, Pikesville Medical Associates, we're going to sit down in the office, go over all your history, go over your information. We'll go then into the exam room. I'll examine you. Then we'll come back to my to the office. We'll finish talking and see if you have the patient has any more concerns, and then you'll leave. So that could be 45 minutes, could be an hour, it could be less. But the whole point is, that everybody understands everything, everyone, and all the concerns have been addressed. And then when they leave, if there's something, and by the way, too, I'm sitting at a desk, so my hand's not on the door,
Right,
and
exactly.
there's only
That's
one
nice. You
exam
sat
room.
down. Oh,
Yeah,
amazing.
and so this way, the patient can also feel, and I want the patient to feel that I'm relaxed and I'm not rushed, and I'm there, to listen to them.
Yes. Now, we jumped over your experience level, which is pretty strong in the Baltimore area. Can you tell us a little bit about what your background has been working in Baltimore?
Sure. I mean, I'm born and raised in Baltimore and
Nice.
went to Randallstown High School, and I
Oh,
went to
there you
Towson
go.
for college. And then I left. I went to medical school in Guadalajara, Mexico,
Oh,
which was an
nice.
amazing experience. I learned Spanish and learned the whole Mexican
Nice.
culture. It was just amazing. And then did my residency up at York Hospital in York, Pennsylvania.
Oh, yeah.
And my parents and family are still here in Baltimore.
Nice.
And so I first started out working as a hospitalist or dedicated inpatient doctor, and I worked at GBMC. And then kind of worked around in a couple other hospitals because I wanted to see what other hospitals were like. And then I got the opportunity to be the director of hospital medicine at St. Agnes here in
Nice.
Baltimore. And I was there for 4 years as their first director of hospital medicine and helped grow the service line. Back then, in the sort of around 2010-ish or so, hospital medicine was just becoming a lot more common, and so a lot of outpatient doctors stopped going into the hospital to see their patients because they were busy with
Yeah.
all the paperwork and all the things they had to do in the office. And so there was a need for more doctors, and so we built that program. And then once that kind of ran its course, I was looking for another chapter. And I went in. I got the opportunity to be one of the first inpatients or dedicated doctors at Future Care Irvington here in Baltimore, and I helped them improve quality and working on dedicated patients in trach with had chronic trachs and on chronic ventilators. And then I got a CMD or Certified Medical Director certificate through the National Association of Skilled Nursing Facilities or called AMDA. And then got involved through my practice in working in other nursing homes and becoming a medical director in a couple other places and helping them also improve quality, be more and all that allowed me to be more available to patients and their families, to be involved in patient family meetings, explain things to patients because a lot of the times the families are still in shock. Mom or dad or somebody had a stroke or a catastrophic illness, and now they have to be in the nursing home for maybe long-term care. We're not sure. And they kind of remember what the doctors told them at the hospital, but they kind
Mhm.
of didn't. And it was a lot of confusion. So I would always spend time explaining that stuff, everything to the
Nice.
patient and their families. And I really enjoyed, doing all that
Yeah.
stuff. And then also got involved in end of life care, palliative care, and hospice care, working in those facilities, which was also really rewarding. And I enjoyed kind of working, helping families through that really hard, the worst time basically of a patient or
Oh,
family's
yeah.
life, at
Yes.
end of life care. And then so I was doing that. I did that for about 10 years or so. And now over the past sort of 6 months, past year, I kind of was looking for a new chapter in my career.
Good.
And I'd always wanted to kind of go get back into outpatient medicine. And I
Mhm.
feel like all this experience I can bring to back to the office to explain to families what happens if you go to the hospital, or how to
Yes,
navigate going to nursing homes or being admitted to the hospital, or the transition of care when you get discharged home from a hospital, what needs to be done, reviewing the medicines, making sure labs are being done, or making sure a patient needs to follows up with a specialist if they need to. And I'm there as a concierge. The patients and families can call me. And when you call, you're calling, an office line that goes right to my cell phone. So
that's
there's no
perfect.
secretary, there's no answering machine. I might not pick up or something, and leave an answer, recording on my phone, but yeah, but I'll call you back within an hour or two.
That's
And so I really
wonderful.
enjoy that. I really enjoy being there. I've been doing that for 20 years as a doctor, whether it's in the hospital or in the nursing homes. I was always giving my number out to patients and families and stuff so they can call me and answer a lot of things, because all that helps improve compliance. It improves outcomes for families and the patients. They understand what's going on. And they're not scared. They're not, and sometimes that fear turns into anger, that then turns into bad outcomes and stuff. So
Right.
it really kind of helped all the I really enjoyed sort of all those transitions of care from hospital to nursing home to home, or home to, nursing home to home, or hospital to home. So yeah.
That's perfect. I feel like there's so many times in a family's life that are like crucibles, and you just need somebody to pull you out of the melting pot,
Yeah.
so you don't die,
Yeah.
right? I mean, it's like we're all little questions and all the traumas go with a flashpoint. So having somebody there that's a steady and objective, that really matters. And that's something that we both have shared. I think I've done that as Dr. Kate, dementia coach too, just being available.
Yeah.
Objectivity, perspective
Mhm.
makes such a difference. One of the things that I particularly love, and I got a little confused getting to your office, but I think Pikesville is a very doable place, whether you live in Carroll County, whether you live in Anne Arundel County. I don't know so you're right there
Yeah.
in Pikesville,
Yeah,
right?
we're right off 695, right off Reisterstown Road. There's a Ruth Chris in the shopping center there. It's called the Commerce Center. And so if you're coming up Reisterstown Road off the highway, you take a right onto Hooks Lane, and you just take a right into the parking lot there. And we're in the East Pavilion, Suite 288. It's called Pikesville Medical Associates.
Nice.
And we're taking new patients, and we're happy to hear from new patients and families and hear people's experiences.
Yes.
And so, yeah, that's kind of it's very easy to get to, right off the highway. So we're lucky to grab that location.
It's a good location. It keeps people from the fear of being in a city.
Hmm.
As we get older, we get a little more challenged with stuff. And yeah, I was, and you should always think about having lunch at Ruth Chris if you can plan your appointment
Yeah,
appropriately,
yeah. There's
right?
plenty of parking.
Yeah, there really is. It was
There's
my own
Chipotle
lack
and a
of
pizza place
understanding.
across the street.
Right. And you were right there to answer the phone when I said, "Where are you?"
Yeah,
Right.
yeah.
So that was perfect. Well, this is great. I just think I wanted to introduce to the few people that I have in my Maryland contact list a really good resource in the community, and I feel very strongly about that. So I appreciate your time.
Sure, you're welcome. Yeah, if patients are interested, they can just email info@pikesvillemedical.com, or just call the office at 443-989-6247, and we'll be happy to hear from you.
Excellent. And I will make sure to try to put that on the end screen too for our YouTube.
All
Thank you
right,
so
great.
much, Dr. Frisner.
All right, you're
Take
welcome.